Hello YouTube. So I want to answer this question in terms of, is there a link between type 2 diabetes and PTSD? In fact, there is, lo and behold. And the link is that there's an increased incidence of type 2 diabetes if you have PTSD, meaning compared to the normal population, normal in quotes guys, because not everybody's normal in the normal population, you have an increased risk of diabetes. This is through the HPA axis, it would be my guess, and the guess of anybody who understands physiology. More or less, the first thing that happens when your HPA axis gets dysregulated and thrown off is that you're subjected to high levels of cortisol because of the stress. Cortisol is your stress hormone. That dumps high levels of glucose into the blood, which tend to persist because you keep getting exposed to high levels of cortisol that keeps shooting out more glucose into the blood. Glucose, let me give you an analogy for what happens when it's in the blood. You have that honey jar in your cupboard, your friend comes over, it drips down the side, and then the next time you go to get honey out, the lid doesn't open very well, or it doesn't close very well because it's all kind of crudted up. That's more or less what's happening inside your blood vessels when you're subjected to high levels of glucose for a long period of time. In fact, one of the blood tests we use to test if someone's diabetic would be, we look at hemoglobin A1C. This is how much glucose is actually sticking to your oxygen-carrying molecules in the blood, the hemoglobin. And if that number is high, then we know in the past 3 months that your blood has been subjected to high levels of glucose on a pretty regular basis. And that's what drives up that number. So some of the chronic effects that we see with high levels of glucose would be cardiovascular effects. You have trouble pumping the blood around, glucose is sticking to everything, therefore oftentimes we see coronary artery disease developing, we see hypertension happening where people's blood pressure will increase to address the fact that you're having trouble pumping the blood around. You have poor circulation to certain areas of the body, and then those areas tend to be more susceptible to wounds and to poor wound healing, and therefore you have diabetics that actually have to lose a limb because their circulation is bad, or they keep getting ulcers and the ulcers will not heal. So all of those are kind of chronic effects of high glucose, being uncontrolled glucose in the blood. And we see some crossover with the HPA axis being thrown off and someone who has PTSD, right? Glucose being widely swinging can also affect your moods, your affect, and so of course that's going to worsen, the swinging moods of someone with PTSD or even borderline traits, that kind of thing. So one way to target addressing this whole HPA axis dysregulation would be to address these widely swinging blood sugars, to stabilize the blood sugar, and in so doing to kind of re-regulate the HPA axis. I will speak about this in a future video. For today, that's it. Thanks for tuning in. Please subscribe, like, share, etc.